We've been using ORCHA for the last 6 months or so to try and help our different clinical services support patients in self-management through the use of healthcare apps. What we want to achieve is better ownership of health for patients. We want them to engage in their care, and we want them to do this in a really safe manner.
So with ORCHA, we're working on an ecosystem of apps that are applicable to our clinicians and our patients. And it's really important that our patients and clinicians can actually hone in on apps that are suitable for them and make decisions about what is going to, work for them.
If we're recommending something, we want to know that it's a good value and it's accurate and it's not going to cause harm. I think using apps is a different way to engage with patients. Everyone's got a phone in their pocket these days. It's easy to carry that around, and it's something that can trigger actions from patients. More importantly for us, apps aren't just about giving information, they're about engaging people with their own healthcare.
So ORCHA have really helped us in a way that we could never have, helped ourselves. The actual breadth and depth of analysis that needs to go into the very many apps that are out there would not be achievable. So they've helped us to hone down from a huge field of players to those that are really applicable in our environment.
I'm a clinician and I know exactly what we need to do to provide care and to provide information. What I can't provide is any form of technical assurance, any quality assurance, and I certainly don't have the time or the resource to check the apps stay up to date, to check that the guidelines or any algorithms they contain are validated and accurate. When we prescribe anything, we take it seriously, whether it's something as simple as paracetamol or a whole range of more complex medications. If we're recommending an app to a patient, I think we've got a real responsibility to make sure it's of a sufficient quality.
I'd encourage people to choose partners for the future around their mobile app strategy, because it is a big job to actually make sure that all of the apps are safe and secure, and that's not something that most organisations, in fact, not sure any organisation in the NHS can do in-house.
So for any trust that wants to go down this road and start using apps, they should have a really clear idea of which patient group they're aiming to help and what outcomes they want to deliver. Do they want to improve satisfaction? Do they want to reduce the strain on services? Healthcare apps, if used appropriately, can do all of these things, and it's this targeting and the selection of the right apps that would let them achieve those aims.
What's lovely to see about ORCHA is actually a UK company who are curating apps and having global success. And what they do for me that is really quite different is take a UK lens on all of those applications that are out there and make sure they're absolutely applicable for the NHS and the care system that sits around us here in the UK.